This video is an excerpt from our interview with Armin Brott, one of the creators of the Certified Men's Health Educator online course, which is available at academy.healthymen.org. Can you say a bit more about what ways in which there's improvements to be made to make things more guy friendly?
Well, I think that a lot of providers do not understand what's going on with men's health. They don't understand that they can't treat men and women the same in practices, and they aren't educated. There was a study that was done a couple of years ago by the Commonwealth Foundation, and they were finding that a majority of doctors did not offer men the same appropriate screenings for their age. So at 45, for example, people should be screened for conditions A, B, C, D. And if you're at a higher risk of prostate cancer, for example, most people are getting screened starting in about their 40s. But if you're a black man, you ought to be getting screened for prostate cancer sooner than that. They're not teaching guys how to do testicular self exams. Testicular cancer is relatively rare. However, it's one of the biggest cancers for young men, 16 to 35. Um, there's just this lack of awareness, and there's also with providers that sometimes they're limited to 6 or 10 minutes per visit, and they just don't have the opportunity. Plus, you've got guys that are not coming in, and there is not the kind of outreach that needs to be done to get guys to come in and have a physical so we can establish some baselines for their health. So that's it. And I mentioned just real briefly, I mean, things like office hours makes a difference. That if guys, that's part of being a man these days. It's just so many survey after survey that being the provider protector is way up on people's list of what it means to be a father or be a man. And so that means you're not going to take off early in the middle of the day to go to a doctor. So if you can't get a doctor visit after hours, you may not go, and you may not go for 10 or 20 years. So the lack of outreach, the lack of an education, the lack of understanding are big things. And then there's also just, I mean, there's not specifically the healthcare system, but it's our entire culture. Is You and I and almost every other guy out there grew up with big boys don't cry, and take one for the team and man up and those kinds of things, which are decidedly dangerous. They basically say don't ask for help, and that translates directly to the fact that suicides are a predominantly male occurrence. 80% of suicides are male. That's 4 out of 5 are male, and 2/3 of opiate overdose deaths are males. And we're not recognizing these things as a society, as a culture, and these are not being recognized in public health situations. Actually, I had a conversation with a guy who runs the county health department here, who said, well, give me an example of a men's health concern. So you're a public health, you're running the health department. How about suicide and opiate overdoses? How about that, just to start with? And he said, you're right. If it were the other way around, and women were accounting for 2/3 of opiate deaths and 80% of suicides, there would be a nationwide women's health crisis, and we would know what to do. We would mobilize the providers, we'd mobilize the educators, and we'd get out there and we'd have public service announcements. And that doesn't exist. It doesn't exist. There are many. I think there are 7 within the federal government offices of women's health that, not including the National Institutes of Health and what's in the HHS. There's a lot of budget that goes billions of dollars a year. Budget that's focused specifically on women's health, the offices of women's health. There are exactly that many. I mean, the zero, not the fingers. 0 offices of men's health anywhere in the federal government that have a budget, and it's pretty surprising. So it's the healthcare system itself, the providers and the educators that we want to reach. But we also want to reach as a bigger goal. We want to change the culture. That the fact that we're talking about men's health does not in any way diminish the focus that should be on women's health. Women can be healthier too. But that gap, the gap between men's lifespan and women's lifespan is significant. That's 6 or 7 years. We figured out, I did a paper as the primary author on a paper a few years ago, um, that lifespan, just that difference of 7 years, not to get men as healthy as, that they could live to 120, but just that they should be able to live as long as women. It costs about $450 billion a year in this country. Just think of how much tax revenue is lost by guys who are dead and they're not paying taxes, and how much extra benefits have to be paid out to widows and survivors of those guys who are dead, or how much work productivity is lost by guys who are injured or diminished in some way, or they're not productive at work because they can't work. They're they're too sick to work full time.
Yeah, not to
That
mention the lost time that children lose with their fathers who are dead.
Oh, well, that's a whole other thing that goes beyond the financial to the quality of life. And then exactly, I mean, you know, the fallout from that, the kids who are growing up without an actively involved dad or without a dad at all are more likely to get involved in drugs and alcohol. They're more likely to become teen parents. They're more likely to end up in jail. So it's a whole cascade of negative effects that happens when you neglect men's health. And the reality of it is this famous expression, the rising tide lifts all boats. When we pay attention to men's health and we get men healthier, women and children and families in our society are going to be healthier as well.